Specific for your surgery, we have several prescriptions for you. You are going to be responsible for picking these up over the next few days to ensure that you have them prior to surgery. These prescriptions will be called in today. As we mentioned before, Keflex is an antibiotic that you will take the day prior to surgery. You must finish this prescription completely. The next is Norco. It's a pain medication. You're going to take this completely as well, if necessary. You're going to take it as needed. You may take Tylenol if you do not wish to take the Norco. You just cannot take them both together. Please follow the instructions on the bottle. Valium is given for a muscle relaxer. It will help with any muscle spasms you may encounter post-op. Zofran is for nausea if you may encounter this post-operatively. Lovenox, if applicable, is an injection that you administer to yourself. We will demonstrate this later on the proper administration technique. You will begin your injection at 8 p.m. the day following surgery. We also recommend that you take a stool softener, as narcotics can cause constipation. You can get this over the counter. Also remember to eat and drink always with your antibiotic and pain medication because it can cause nausea. If applicable to you, we would like for you to stop taking all estrogen hormone replacement and estrogen-based birth control, including oral medication and patches, preferably 4 weeks prior to surgery and 2 weeks after surgery. Please use other forms of contraception to prevent pregnancy. As for showering, we will provide you with a scrubby brush today. We would like you to scrub from your neck to your groin, under your armpits, under your breasts, and in any creases and crevices. Okay, now it's time to talk about specifics to your surgery. We will start your surgery more than likely with you lying face down on the OR table. Dr. Schantz or Dr. Turner will make several small incisions approximately a ½ inch long. They will be closed with 1 to 2 stitches, which will be removed by the nurse at your 1-week post-op appointment. They will inject tumescent solution through a small incision. The tumescent solution is a mixture of LR, lactated ringers or IV fluid, epinephrine, which causes your blood vessels to constrict to minimize any blood loss, and then lidocaine to numb the area and allow the fat to rise to the surface. The doctor will then remove the fat through the liposuction cannula. Okay, so let's talk about your dressings. Your liposuction incisions will be covered with a small coverderm. We will also place maxi pads over your coverderm incisions to absorb and minimize the leakage of any tumescent fluid. There is no way to predict ahead of time if you will leak fluid. It is a normal thing. It just looks a little bit scary. We like to ask you to have some Chuck's pads or puppy pee pads available at home to cover your car seat for the drive home, as well as your couch or recliner or bed. The leakage will usually only last about 24 to 48 hours if it happens to you. You will also have foam padding, which will be used for providing compression to your flank area as well as your abdomen. And finally, you will have a binder, 1 or 2, wrapped around your core holding all of your dressings in. Day 3 is a big day. You may not remove your binder or foam padding until the 3rd day. On this day, go ahead and remove your binder. It's important to have your caregiver assist you in this process. Also, be close to a chair or a bed in case you get lightheaded. When you slowly remove your binder, you may feel lightheaded as you may have a big fluid shift. Rule of thumb: anything that drops to the floor, go ahead and pitch it. Whether it be your foam, gauze, or maxi pads, just go ahead and throw it away. Then you're left with a new, flat, nice tummy. This is a good time, now that you have everything off, to put a cami on. The cami helps to prevent any shearing or skin breakdown that the binder may cause. Just go ahead and put it over your bra in between your body and your binder. You want it snug without any creasing to provide the maximum compression possible and to help minimize any swelling. You will wear your binder for 6 weeks at all times, during the day and at night, except to shower. Feel free to wash your binder. When you come in for your follow-up appointment, feel free to ask us for an extra one. It will become like your security blanket. You're going to want to wear it. Around your 6-week appointment is when we'll instruct you to discontinue the use of it, but it's best not to quit cold turkey. After surgery, we want you to rest, but we also want you to get up and walk around as much as possible. Get up, walk to the kitchen, get a glass of water, walk to the bathroom, but then go ahead and lay back down. Also, remember, no heavy lifting or straining, nothing heavier than a gallon of milk, no household chores. So that means no laundry, no dishes, no vacuuming. Okay, so a couple little tidbits. Sleeping. You must sleep in an elevated position, whether it be in a recliner or in the bed. If it's in the bed, usually use about 3 or 4 pillows. At your 6-week appointment, we generally release you to resume all activity as you're able to do so. After surgery, avoid any direct sun exposure to your incision for at least 1 year to avoid any hyperpigmentation to your scar. It's really important that you follow all the instructions provided to you in this video to ensure your best possible outcome and result. At this time, ask your nurse any additional questions that you may have. Also, prior to your procedure, go ahead and review this video again and give our office a call with any other questions prior to your surgery.